Hey everybody, this is Dr. Shah. We are going to do a different series today. Basically, we want to give you guys a little bit more insight to our practice and kind of the way that we are doing things for all of our patients. So I figured what would be a better way of doing this than actually doing a fun little case study with you guys. We're going to showcase one of our little girls to you guys today. This is a actual patient's paperwork and everything. Obviously, we've redacted all the different informations and all the different things on it, so that way you guys can see behind the scenes kind of what our process looks like, and that way for those of y'all that are considering getting your kids under care in this office, you guys can see everything that we are doing. Okay, so our process, guys, is pretty straightforward. Before you guys come in, we do request you guys to fill out some paperwork, so that way we can see everything that's going on. And as I scroll through the system, you guys are going to see this screen is actually over here. So if you see me look over there, that's what's going on. You guys are going to notice that our paperwork is pretty extensive, depending on all the different things that are happening. So there's a couple different interesting things I want you guys to see about this case. So this is, we're going to call her Annie for this example. Annie is a 16-month-old baby that we're taking care of. On her original paperwork, as you guys can notice, she is already seeing an OT. She has a primary care doctor as well. The one she's actively working with right now is an OT because the conditions that bring her into our office are going to be motor delays. Annie is 16 months old. She cannot crawl. She cannot walk yet. The mom noticed that around the 9-month mark is when they really started to notice that there were major motor delays, and she wasn't able to roll herself either. Now, they're trying out things like tummy time, OT therapies, but what they're noticing is that this thing is not progressing. This case is just stuck. She keeps getting bigger, thankfully. She's still, putting on weight, but neurologically, she is stuck. She doesn't sit up. The funny thing is, when the mom brought us in, she was more worried about the fact that she can't crawl or anything. She can't crawl, she's not willing to stand up, she's not walking. But what we have to figure out is what's the first thing on the normal neurological progression for this kiddo that's not occurring. And one of the first things that we notice is this kid doesn't reach. They don't reach for things. They also don't really sit up. They can't hold themselves up. And one thing that we also noticed is that she only talks in one syllables. So that lets us know, okay, neurologically, she is definitely stuck a lot earlier. So we're going to dive a little bit more into what we call neurological age versus chronological age. So we knew her neurological age was definitely stuck a lot earlier, and we are going to decipher where the original incidence of injury is actually occurring, so that way they can see kind of what it is. The interesting thing on this case, if you actually look through, she did not have any fertility challenges, which is something that we see pretty commonly in most of these cases. No smoking, no drinking, mother was exercising pretty steady as well. However, if you start reading then into a little bit deeper, where we ask the moms to explain kind of what's happening behind the scenes, there is a lot more information that we're given. So around 32 weeks, this baby was diagnosed with what's called an intrauterine growth restriction. Basically, they did not think the placenta was providing enough nutrient to the baby. They didn't think her baby was growing at a proper pace. They also thought the baby was breech, and about 2 weeks later, the baby is at the hospital. They do an emergency C-section to get the baby out. So once the baby actually comes out, the only thing that they were noticing is that this baby was underweight. This baby was about 5 pounds. And thankfully, God bless, she didn't have any NICU time or anything like that. So this baby was born via C-section. I know it says scheduled C-section, but this is something that they scheduled at that time when they had done the ultrasound to figure out what's going on, all the different things, to make sure that everything is going nice and steady. But at that point, they decided to do a scheduled C-section for her. Now, during the actual birth, they had to not only use, it's a C-section, so obviously they had to put her under, do an epidural and all the different things. She did leave out a couple of things in here, but actually when we started talking to her, she did say that when they were pulling the baby out, the doctor did lose grip and the baby was kind of shot back inside her once again, and then they had to pull the baby out once again, putting that extraction trauma on the baby's upper cervical spine, not just once but twice. Once the baby is born, they start running into some other issues as well. So upper cervical spine, the neck, that's what's responsible for majority of the movement. It's called a rooting reflex. The rooting reflex is the one that basically the moment your child detects a nipple, they are supposed to turn their head to the side and latch on. But as you can notice on the paperwork, this baby was not able to latch on properly on one side because she had that rotation restriction created by that upper cervical damage, neuromotor restriction, baby can't turn their head. So eventually they had to start using formula. and whatnot as well. Now, this was a major clue to us as a provider, and if there's other chiropractors watching this, they're like, boom, that's the issue right there. Is the fact that the mom said that she bangs her head constantly. This constant motion that you see, these motor stims and all the different things that we see, especially in our autism cases a lot of the times as well, is a very clear indicator of what we are potentially looking for. And this is the one where we're like, okay, I think we're in business. We see the issue. By saying we're in business, what I really mean is, in order to solve a problem first, you have to identify it, right? So part of our whole consultation program is to decide, is this a case that we can actually help out with or not? So we ask all these deeper questions, so that way we can sit down face to face to the mom to dive deep into it, because we have to identify, one, the original incidence of injury, and two, the major signs and symptoms of this injury that actually results in letting us know that yes, this is a vagus nerve dysfunction, this is a neurosensory problem. If it is, we're in business, let's work. Okay, let's go back. So she bangs her head constantly. If you look at the neuromotor milestones, it seems like, she's keeping up with most of the different things, but here is where the delay starts to occur. The entry-level milestone she's having them pretty quickly, but if you notice right around over here is where she starts to kind of fall backwards, right? Where not necessarily fall backwards, she just kind of just like, things just kind of come to a halt. She also has a food sensitivity and whatnot as well. She did have mild vaccine reactions where she had a mild fever and a rash. She still has eczema and all the different things on her skin. As well as some of these questions are not really relevant to her because she is a little bit younger and whatnot as well. So let's go a little bit further into her paperwork as well. Now, in the past, like we said, when she was born, she had difficulties latching, but now one of the issues that we're running into continuously is that the baby is frequently just stiff, rigid, arched. They can't arch their back, arch their neck. They're having motor milestone delays. They can't coordinate, obviously, because hand-eye coordination is a neurosensory input, and that's something that we can dive into in a little bit as well. So yeah, still balance coordination issues, and she says her baby doesn't really sleep well. It seems like her baby's just always tired and all different things as well. Okay, so that is the end of our paperwork. Now, at the end of our paperwork, we have a couple of big hallmark findings in this paperwork, especially the one with a kid, born via C-section, mom is stressed out, pre-birth, banging their head constantly. I'm like, okay, there's 2-3 things that we're potentially looking for in this scenario. So now let's go and confirm our theory, because that's what we do as a doctor, right? We have a theory, now we have to test and see if we can confirm it. So we ran our scans. So this is a neuroscan that we did for baby Annie. Let me zoom in just a little bit. Now, these scans have 2-3 different pieces of information on it. I'm gonna go the really easy one that's visually really easy to explain. Is going to be this scan right over here. Okay, I want to move my screen just a little bit so you guys can see it a little bit clearer. Okay, so overall what we're seeing is 2 particular areas. Now guys, this is a neuroscan that we do as part of our consult in here. Basically what we do is we take the neuroscan CLA inside device, we run it along the whole neurospinal column for the kiddo, figure out wherever we're picking up heat signatures, because wherever we are picking up heat signatures, that is a hallmark of damage underneath, because inflammation is the hallmark of damage. From that point, we can identify where the original incident might be, where the injury is actually manifesting itself, so that way we can go address from there. Just like we thought, she has, if you notice right over here in the upper cervical spine, I don't think you guys can see my screen when I record it, I'm not really sure. Okay, right in the upper cervical spine, there are these red bars that lets us know that there is some inflammation, there's heat coming off of this. But what's fascinating is not only does she have damage right up over here in the upper cervical spine where the vagus nerve, brainstem, all those different regions exit out, she also has the opposite section right over here down in the sacrum as well, which is going to be the low spine area. This area right here and the top area right here, these are your parasympathetic chains. This is the start and stop areas of the parasympathetic system to basically help your system calm down, letting us know that her system, yes, is not entering the resting or digesting phase. It is continuously stuck in a fight or flight mode. One thing we are also noticing on these scans over here for her, this is a different scan that we do. All you guys really need to know is we're also testing out how much unnecessary energy input her system might be giving out, and her basically how much heat is coming off of her system to let us know how hard her system is working for no reason. And as you notice, there's heat coming off of both sides, but there's only one-sidedness, which lets you know that one side is definitely working a lot harder than the other. These are the cases that typically what we see is what we call the floppy baby syndrome, where Your kiddo is very, very rigid, very, very stuck, and then all of a sudden they start becoming kind of like floppy. What starts to happen is that the nervous system is so stressed out for so long that eventually it just gives in. So that's something that we were starting to see the signs of. Thankfully, this kiddo was not there just yet. Okay, so once we have this solution, once we have found this thing where like, hey, we have a theory, we tested it, we have a confirmation, seems like we know where your child's issues are coming from, here's what we're gonna do. We came up with our care recommendations in this office. In our office, we always do short and longer term recommendations. For this case, we gave the mom the option of the longer form of care, which is about, for this case, was about a 24-week program that we came up with. But I strongly encourage this mom to follow our neuro-intensive protocol program, because with younger kids, time is of the essence, so we could work a little bit faster on this case. So with this kid, we did a 16-week care recommendation for her, but we do checkpoints pretty frequently. We do a checkpoint about 2 weeks in where we come in and we do scans. Then we do a checkpoint about 4 weeks in, we do scans, paperwork, and all the different things. And I just wanted to share with you her reevaluation paperwork that the mom shared with us as well. So that way you guys can see how the progress is going for this baby, according to the mom, because moms know their babies better than we do. So in just about 4 weeks of care, the mom had noticed that she was having mild improvements in motor, the motor, crawling. She had started to crawl just a little bit. Her hips were engaging a little bit more. The funnest thing that we were seeing that she wasn't having the motor stims anymore, so the constant banging that she was doing was becoming very, very rare. Frankly, she had filled out the motor stims in this thing because she was thinking about the hands, but when we asked her in person about, hey, what about the head banging and the little vocal stims that she does, she was like, I'm actually noticing them less and less and less. Which is fantastic. This is also further down the paper. She's starting to move better. Nursing and latching is not really valid in this case anymore, but we still kind of bring on those cases so that way we can see all the different things. Head banging is improving. Stiffness, rigidity, arch. I mean, you guys can read some of this stuff. I'll give you guys just a couple of seconds. If you guys can notice, in just a couple of weeks of neurologically focused care, not only does the system start to respond, the system starts to come alive. This is where we really like to emphasize, guys, we are not treating these symptoms. That's not the point of the care that we provide. Our job is to unlock the nervous system so the nervous system can heal at its full capacity. This is what happens when a child who has the innate ability to heal, you take that stress away, you allow the system to respond. You notice how the system responds really, really quickly. This is actually one of the funniest things, the most fun part of this thing is, in her mom's own words, she's more focused, she's interested in playing, she's learning about the world, her stims are getting better, but there's still some days her hips are engaging more. And for me, I thought what was fascinating is now we're reaching the next level goals. Now she wants to have more upper strength, more coordination, so she can crawl, so slowly but surely we can kind of go from there. If you guys notice right over here is, the whole time we're working alongside our OT friends, because these kids, they require a lot of work, a lot of effort, and there's a lot of different providers that get involved. So parents, we know how hard you're working. We know all the different providers you guys have seen, but this is a major breakthrough that we started having with this kid. And I just really wanted to just come in and kind of share that with you guys, so that way you guys can see everything that's going on. She does also follow us on Instagram and whatnot, so that way she can see everything that's going. I guess I can scroll down and see. I actually don't remember this part. Hopefully she left me a good note. Amazing. Okay, cool. So glad to see that. We take little feedbacks at every single step from our patients, so that way we can make sure that we're providing a 5 out of 5 experience every single time. 5 is the standard of Inspire, 4 is unacceptable, so we really like to make sure that every single step of the way for every single patient that's under care in our office, they're having an incredible experience. Well, that being said, guys, I hope you guys enjoyed that, and we'll do a little bit more of these down the line. So take care. What I would recommend you guys do, if this case resonated with you and this was information that was very helpful, click the link in the bio, so that way you guys can learn a little bit more about our neurointensive program. The first step, guys, I would just say schedule a phone call with us. We charge $20 for a phone call. If after that phone call, we realize that we cannot help you, or if you're not a good fit, we actually dismiss you and give you your money back. So because we don't need your money, we just want to help each out. So I would strongly encourage everybody to schedule a consult with us. Let's figure out what's going on with your kid. Let's get some scans in. Let's get these kids healing. Take care.